Hi, Dr. Chris Gooble's here with Square One, and I have one of our patients, Barbara, and we just were going over some of her treatments over the last, not quite a year, but almost.
Almost a year.
And I asked, her to share her story. So first, can you tell us just like, what brought you in? Like, what were you dealing with before? Like, what was bothering you?
Mostly lower back pain that would then migrate up to my upper back and by the end of the day. And then I was having difficulty walking.
Difficulty walking. Is that because of the pain, a lot of that? And then having difficulty walking, like how was that impacting shuffling? You were shuffling your feet. How did that just impact your ability to do things you do in everyday life? Like what?
Having a real trouble gardening and just walking around the house or just taking my dogs for a walk.
It's not good. And then did you do any other treatments before you came in here?
No, not really. Exercise.
Exercises. And then how did you hear about our office?
I Google.
Google? Were you looking for anything specific?
I was looking for someone that would do lower back pain.
Lower back pain. Okay.
And that would be convenient to where I live.
Yep, because you don't live real close here.
No, takes me 45 minutes.
45 minutes. And then when you came in, we did a few things. So you were doing chiropractic care. We were doing traction, right? And then you wore a custom kyphosis brace. Right? And then we recently did your follow-up x-rays, right? So first of all, how are you feeling? Like, how are you feeling with the treatment? How has it helped you?
The back pain is almost gone, except for in the morning I'm a little bit stiff, but then I work out of it. When I wear the brace, I don't feel any pain at all.
So nothing at all?
Yeah.
And then how was that like before? Like what were your pain levels like, would you say, in severity before and frequency compared to now?
Well, before it was like almost constant lower back, and then it got worse as day went on. And so it was like, close to a 10, but now it's like 2.
So almost like nothing. And you said one of the things is because you're not close by, especially when the weather gets bad, it can be difficult to come in, but you can still do your home exercises and you can wear the brace as well. Right? And how many hours a day do you wear your brace currently?
About 2 hours a day.
About 2 hours a day. And then we did your pre and post x-rays. What did you think when you saw those?
I was kind of amazed.
So because you were really hunched forward,
yeah.
Which we said that was one of the things that was driving your low back and upper back pain. And we reduced that quite a bit. And we know that that's stable now because you're still doing exercises and you're still wearing the brace.
Right.
So what would you tell to someone that was just like you, dealing with the same issues, back pain, they're starting to hunch over, they've been looking for help? What would you recommend?
I would recommend you come here and get the same treatment I did.
Perfect. Well, thank you for sharing.
Thank you.